Hello and welcome. In this lecture, we're going to talk a little bit about program evaluation. So you've all thought about different types of challenges that you're facing in healthcare and thought about what types of processes you might put in place to try and achieve the outcomes that you're interested in having. Now, there's another element to this, which is planning for how we actually demonstrate whether or not a change has occurred as a result of this program and how we actually track the progress of that program over time. So very often this is thought of as being left till the end of a project, that you do the evaluation afterwards. But as we'll discuss, it's actually really important to be thinking about evaluation from the very beginning of program development. So what is program evaluation? Well, you already are familiar with research and research approaches. So it's actually, in many ways, a lot of the ideas, approaches, and challenges that are faced by program evaluation are very similar to research. So in some ways, this lecture isn't going to go into a lot of the details around research and research methodologies, because I assume that you already are fairly familiar with those. The difference between program evaluation and research is that it has a different purpose, basically. Program evaluation, the main goal of it is programmatic goals, right? Research is primarily focused on creating generalizable information. So you're producing research and information that people can take and apply elsewhere. And that requires certain types of methods and certain types of frameworks and ways of thinking about things. And in the context of program evaluation, your main goal is really to serve the interests of your program in terms of gathering the information that you need for your purposes. It also is not necessarily focused on answering a very specific research question and asking lots of questions to address all elements of that possible small question. Very often program evaluation has a much more expansive goal. It's trying to understand the program as a whole. So it's assessing a wide range of different types of activities, right? So although it uses similar methods and it uses a similar sort of framework for thinking about the approach, it is doing something somewhat different, and it has and sometimes it will use different strategies as a result, or slightly different approaches as a result, because that generalizability is not the main goal, and answering a very specific research question is not the goal. Now, all that being said, it's actually quite common that people who do program evaluations sometimes publish those program evaluations, and that's often very helpful for people who want to do that program, similar program somewhere else in the future, right? So it can be quite valuable. I've had students who've actually done that with their projects in this class, where they've done program evaluations of their projects and published them. So, so the two can be related, but again, with program evaluation, the primary goal is serving our greater understanding of the project and how it's going and what its outcomes are. So why would you do it? Well, it actually serves a lot of benefits for a project. So the first one may not be intuitive, but actually thinking about evaluation from the very beginning can actually help you with planning, because it's going to force you to think about what are the actual things that you can measure? What are the outcomes that you can look at? And are these things that are actually observable? And sometimes by actually thinking about whether or not you can actually assess something, it actually can inform your project and your approach. Because when you have amorphous goals, they can often benefit by being refined to have something that is actually measurable and observable, right? The other thing that evaluation can do is very often you're doing evaluation through your program as it's being implemented. And what it can do is help you to refine your process. So if you're implementing a new clinical technique, you can do audits, for example, and that's part of your evaluation component. And as you're doing those audits, that can tell you what's working and what's not working. And it can tell you that maybe your initial plan, your initial logic model actually was missing something, and you need to revise that logic model to have things work better. So collecting that data as you're going rather than just doing it all at the end is actually really valuable. It also, I should also note with respect to planning, in planning your program, you also need to understand what the needs of your organization are, what the situation is that you're dealing with, and what your priorities are for what needs to be addressed. So these types of program evaluation assessments can actually help you to steer your project in the right direction as well, in addition to thinking about the different components that you want to address in it. Right. So once you're doing it, it can also help you refine the intervention. It also helps you to understand the outcomes, right? So both in terms of writing the outcomes and thinking about what they would be, but as you get more information, collect that information, you can actually get a great deal of insight from the program evaluation data that you're collecting. If you're thinking about a project that's an ongoing project, it can give you the data that you need to improve it in the future. A lot of evidence-based practice projects are continuous improvement projects. And the goal is that you gather data which can get you information that and suggest information that you didn't even realize when you started out. So it can suggest that maybe there were other things that needed to be worked on that you haven't actually started on yet. So this can give you insight into potential new directions in the future. The evaluation data can also help you to demonstrate success. And that's really important when you're working with stakeholders. So being able to show that you actually have achieved your outcomes, have had an impact on a healthcare system, these are really important things for showing your stakeholders that you're actually doing something and building those connections. And also, to be honest, it's crucial for ongoing funding. So if you do a project, so we assume that you're doing a project because you care about it, you're doing it because you think it will make a difference, right? Your project is not going to do anyone much good if you do it for 6 months, but you don't get the funding to continue it, right? It might do some good for 6 months, but it won't do anything long term, right? If it just gets canceled after 6 months. So part of your planning, part of your thinking about a project from the very beginning is how do you gather the data that you need to demonstrate to potential funders that this is something worth continuing to fund, right? If you fail to do that, then your program, you won't be able to maintain your program, and you've put a huge, immense amount of effort into a project that will just disappear. And that is a huge problem with general intervention design, is that people design interventions without that long-term view, and there's this churn of multiple interventions, and you've probably seen this, that address similar issues, but that sort of just don't sort of disappear and phase out after a period of time because they lose funding or lose interest in various different ways. So thinking about gathering the evidence that you'll need in order to show that your program is working, and also demonstrate possible interesting ideas for how to improve in the future. Those are two things that will really work to your advantage. All right. So you've already thought a lot about logic models. So I've talked just now about how this can be important for helping you plan and demonstrate and implement your program. But one of the major components to doing a logic model is actually to think carefully about your evaluation component, right? So by having a logic model where you have clearly laid out the different components to it, as we see here in the worksheet, you can actually go through this worksheet with all these different components of situation, priorities, inputs, outputs, outcomes, assumptions, external factors, and you can think about what the things are that you need to measure to really evaluate this program. It's very hard to think about evaluation carefully without this clearly laid out in a logic model, right? So the two relate to each other very closely, and that's why evaluation is a part of the Wisconsin logic model and other logic models. So as you go through this, as you look at your model, you can go through each of those elements and think about, okay, what what are my questions here? What do I need to know about each of these elements? And how would I actually effectively measure that? And do I actually think that the measurements I have would be of high quality or not? And we can use our knowledge about research and research methods to think about those different types of information. So this type of evaluation occurs at all levels of planning, as I said, and it should occur from the very beginning in terms of assessing your situation and other priorities and other things like that. So the need, situation, priorities you'd think about, the inputs and outputs you'd think about, different ways to measure that, outcomes you'd think about measuring, and the impact you'd think about measuring. And, there's terms that are sometimes used for these different stages. One is called a formative evaluation, and that's evaluations that are looking at sort of the process as it's occurring, right? So as you're working on the project. And the summative evaluation is looking at the outcomes of the project and the impact of a project after you've already implemented it. So those are some terms that you might see out there, all right? So when you think about your project, you need to start by thinking about what you need to know. What do you need to know about whether or not this project is working or whether or not it has the potential to work, all right? How you would know it, right? What information would you need to answer that question? And whether or not you need to making any comparisons, right? So there's some things that you'll measure at a single point in time, and that will be your only measure of it. But very often you actually want to think about this chronologically, where you might have a pre-post design, where you measure something before your program and then after it, for example. So these comparisons can be crucial, because if you don't think about this from the very beginning and you do your project and then you measure it afterwards, you can't show progress, right? Because you just show what your data is after the study and you can't show what it was before the study, right? So you can't show that your project made any difference, and you might not get funding. So this can be really important to think carefully beforehand about what the comparisons are. So the way that you measure things are through the use of indicators. Indicators can be pretty wide and broad in terms of what you would use to assess whether or not your program is working. So examples of this could be medical records, that's very common, different databases that are available to you. You could be doing surveys of your stakeholders or people implementing the survey or your patients, right? And there's many established surveys that you're doing anyway, or other types of data sources or standardized data sources, Press Ganey or other things like that. You can conduct interviews with people. It doesn't have to just be quantitative data. It can also be qualitative data about how people are thinking about and experiencing this. You can also do observation. So audits or other things where you're seeing how something is being implemented and doing evaluation of that implementation. You can do tests to see if people understand things. So if you're doing an educational approach, maybe you're testing people to see if they have the knowledge they need to have. You can look at performance data of various sorts. You can look at factors like, did people show up to the workshops? Was there attendance? You can look at various different types of expenses. There's actually a very wide range of different things that you could look at. It goes on, but really what you're doing here is you're looking at your project, you're looking at what you're trying to do, and you're thinking about how would you measure that, or what sort of things would you expect to see if you actually were successful in achieving your goals, right? So for each of your indicators, there is something you should be asking yourself questions about them. So one question that you want to ask about each indicator is, how direct is it? How directly does it measure something? So what I'm saying there is, very often we're doing interventions that are trying to improve health. And you want to say, I did this project and it improved health in X, Y, or Z way, right? But sometimes it's hard to measure health. So some health outcomes don't occur for 20 years. So if you're doing a prevention program around cancer, you might not be able to show that that your intervention decreases cancer risk. What you could show perhaps is that you did intervention and it decreases a behavior that increases a cancer risk. So that would be a less direct way of showing that you're achieving your goals. So obviously, the more direct, the better, typically. But very often, especially in program evaluation, we have to find various different indirect ways of measuring what we're looking at. And sometimes we have to be quite creative about that. But it is something to sort of note there. Another element is how specific is it to your question. So can you find answers? Can you evaluate in a way that really answers as specifically as possible the question that you're asking, right? If you're collecting data, how useful is it? You don't want to collect data, you don't want to put a lot of energy into collecting data that doesn't give you a lot, right? And there's a tendency, which is very common and very tempting for a lot of research especially, is to collect tons and tons of data and sometimes much more than you need, and then just analyze it all. But sometimes, especially in program evaluation, you have to use your resources wisely. And you want to make sure that what you're collecting or what you're doing is as useful as possible. Another element is practical. So some evaluation would be really nice if you had the money to do it, right? But is it something that you can do, affordably? Is it an evaluation that it might scientifically be better, but it would require that nurses collect tons of data during their actual time with patients, right? And that's not practical because it would distract too much from providing care, right? So you would think about that. And another element is it accessible and culturally appropriate to the population that you're working with, right? So certain types of measures may or may not be useful for certain groups. So when you think about literacy, when you think about different types of information, there's a lot of standardized evaluation tools out there, some of which are written at levels that you have to have graduated from college to understand what they're even saying. So you want to make sure that the population that you're working with would be able to use or interact with effectively with the measures that you're trying to assess. All right. So when you think about your program evaluation, I'm going to ask you to be working on a worksheet where you go through a range of different things. So the first element of that worksheet is the question. So the question that you're thinking about is basically, what do you want to know, right? What is the problem, the need, process, or outcome factor that you're trying to evaluate that you want to know overall? Then the second question would be, what indicators or evidence would you want in order to answer your question, right? Now, very often for questions, you might evaluate it multiple ways. So if your question was, is my new central line process better, right? So one way would be looking at infections rates. But another way that you could look at this would be satisfaction, perhaps. Another way would be looking at the impact on workflow, right? So there are different indicators that you could look at for different types of questions, right? And very often you'll have multiple questions for different projects. So it won't necessarily be one. So sometimes they'll be nested under multiple questions. Another question that you ask is, when are you going to be asking these questions? When are you going to be collecting this evidence? What is the timing of this? So remember, very often you're collecting pre-post data, right? So you want to think about this beforehand. Is it some data you'll only be collecting while the intervention is being rolled out and as you're trying to refine your intervention? So that might be audits, for example, right? So just knowing when an evaluation has occurred so you have a timeline for when you'll be doing these different steps. So when it comes to data collection, you would want to ask a few different things. So who's going to have the information, right? How are you going to get it? What are your methods for gathering that information, right? What is your sample going to be? So that'll be relevant in different types of approaches, but who would we question and how? And then what tools, can we standardize this in some way? Sometimes that's appropriate, sometimes it isn't. But what measurement approaches will we use to actually collect our data? Then we would also ask, what approaches will we use to analyze that data? So you can collect lots of data, but if you don't have an approach to actually analyze it and then ultimately interpret it, you want to have that in place. So you want to think a little bit about who's going to do that and how you're going to do that. Can you collect that in a way that's accessible to that analysis and interpretation? And then finally, the analysis interpretation is not necessarily useful in itself unless the results are actually communicated in a way that's effective and useful. So how are you going to, as you gather this information, as you're going through your intervention, right, or as you're planning your intervention, or as you're starting to find out what your outcomes are, how are you going to share that with your stakeholders, and how are you going to use it effectively to achieve the goals that you want, and how would that communication occur, when, where, and how, right? So that's program evaluation in a nutshell. And those are some of the things that you would think about if you were to sort of take a project which has many different moving parts and essentially analyze it using different methods and different indicators to answer the questions that you need to have in order to show that your program is effective. And I can't emphasize enough how important it is to think about this evaluation from the beginning, because it is crucial to both having a program that actually effectively addresses the needs of your healthcare system, to actually having an intervention that is likely to work in your healthcare setting, to having the outcomes that you want, and the impact that you want from your program. And having your program reflect not just the evidence base that you have from the literature, but also evidence from your location where you're working. So that's just a basic introduction. It should be a lot of this really relies on your knowledge about research, but I think that tying this in with the logic model really helps explain how these concepts really tie into developing effective and useful programs. All right, so thank you very much for listening. I hope that was useful to you, and take care, everyone.